My name is Curtis Zunigha. I'm an enrolled member of the Delaware Tribe of Indians. We are the modern-day incarnation of the original Lenape people, the indigenous people of New York City. Our original homeland extended from really the foothills of the Catskill Mountains all the way down through New York, that corridor that reaches into Philadelphia, all of New Jersey, and into a little bit of the northern part of what's now the state of Delaware. Our westward migration, which was forced upon us, took us out of New York and Pennsylvania. I am also a co-founding, co-director of the Lenape Center, which is based in Manhattan. Our mission really is to bring back the cultural and historic presence of the Lenape people. As you can imagine, the scourge of smallpox being brought upon a people that had no immunities at all quite quickly spread in very, very rapid epidemic proportions. It wiped out a significant number of people along the villages that were on the waterways right up here in the island of Manhattan, Brooklyn, the Canarsie people, and others. The effect really was not just from the disease, but the politics that went around it. A lot of that had to do with the belief and historical evidence that smallpox was used, quite frankly, as a weapon of war. In effect, to have what they called match coats or blankets that were taken off the bodies of diseased victims of smallpox and given to the native people, ostensibly as a gift, but it was really a form of germ warfare. Then when smallpox was introduced as a weapon of war, the elders thought of it like our Creator is punishing us with this disease for not living up to our more egalitarian beliefs, and we should not be doing this, waging war with these people. And this must be some sort of punishment from God, from the Creator. In our language, the Creator of all things, Keshe Lemukong. The younger generation, the hot young warriors, said no. These guys are trying to kill us, and we need to go after them. So it created an internal struggle amongst our people from a political standpoint, from a social standpoint, as we, or as they, became weakened by the effects of this disease. So it was far more than just pockmarks on the skin. It affected a society and their societal strength, their makeup, and their will to continue. Diabetes is still a major disease that affects Native people. This goes back all the way to some of the original treaties, when Indians were told, we're going to take you off of your original lands, we're going to put you on a reservation. You can no longer go out and do the hunting and the gathering and the foraging. We want you to stay right here on this reservation because you're going to upset the white people, and we're not going to kill you anymore, but we're going to keep you contained on this reservation. So if we can't do natural organic farming and hunting and normal traditional sustenance practices, and we have to stand there and wait for the government to bring us our health, education, and welfare, our food, what did that food become? They gave them sacks of bleached white flour, sugar, and in some cases some rancid meat, if that. And Indians are like, well, what are we supposed to do with this? In time, they learned to make what we call today in Indian country fry bread. So you take bleached white flour and you're cooking it in lard, rendered animal fat. That's what kept them alive. And if you break down fried foods, fried in rendered animal fat, that's breaking down in your body as a major contributing factor to diabetes. So changing health practices and food and nutrition practices is one of the long-term goals that are needed to get over on generations that have grown up with this. One of the biggest health issues that Indian country is dealing with are mental health issues. And this goes back to colonial contact era and the federal government's attitude toward Native Americans or American Indian people. Treaties were broken, promises were not kept, and in the case of the Lenape, we were forced into a migration out of this area now known as New York City. And when we have to ask permission to occupy our own lands, when we have to stand in line in government-delivered health services that we all know are underfunded, then we get the leftovers of health services. All of that from one generation to the next, from one decade to the next, from one century to the next, having to grow up with seeing your Indian parents hang their heads and say, we're victims, but we're powerless to do anything about it. All of that collectively is what I call historical trauma. If you grow up believing you're never going to ascend from the lower end of the socioeconomic scale, then you quit trying, and you're willing to take the crumbs that fall off the table instead of rightfully demanding your place at the table. We have issues of depression that lead to suicide. It leads to people going into medicating themselves, and so you have higher statistical percentages of alcoholism, drug abuse, and abusing each other or abusing themselves. And why was that? Because of this historical trauma, because the government, regrettably, has not done a great job of taking care of the people. But they've never allowed them to ascend to a point where they could take care of themselves. There are remarkable efforts by learned Indian people to reverse that trend, but it only happens with economic resources. The Cherokee Nation has built an incredible health delivery system to deal with many of these issues, and it's more than just the therapeutic delivery of health services. It is also becoming educated in preventive measures, all the way from nutrition, education, and personal empowerment. We are more holistic in our approach toward dealing with health issues. And that also involves ceremonial practices that oftentimes occur on a seasonal cycle. These practices have been going on for thousands of years. 150 years ago and even 100 years ago, those practices were banned, they were outlawed, and people were punished for doing that. These ceremonial and religious practices are very much a part of maintaining the overall health of who we are, keeping our minds strong, and helping to overcome trauma and dealing with it with the belief that the Creator and the ancestors are still there for us. The use of traditional medicines, the gathering or growing of herbs for both culinary and medicinal uses is still very much important, and the knowledge of how to go out and gather. There are very few elders left that know that, but I'm encouraging a learning curve of how to go out and recognize and gather these things and go back to traditional healing practices. That's kind of a long-term approach that needs to be done. It's just returning to the original ways. Among the Lenape people that I'm aware of, we don't have a commemoration, so to speak, of what happened then. Those stories are not around anymore. However, there are stories that are used as kind of an example of something bad that may have happened to the people. Fantastic stories of redemption, of someone who rises up as an instrument of God, as a messenger, as a prophet, as a warrior representing the ancient spirits, guided by the Creator, Geshe Lamukong, the Creator of all things, who helps people rise above that moment of despair. These are the stories that are told to give hope and inspiration to young people, and how hope can be manifested in their own actions and find a way to rise above it. Maybe they might go to college and become a doctor or a nurse and take their learning back to their people and help them rise above this.